Hello, my name is Nerlyne and I am a GYN Oncology Fellow at Johns Hopkins. I'm here today to present my project on hormone replacement therapy, HRT, in premenopausal women with borderline ovarian tumors, also known as borderlines. Borderlines are often diagnosed in premenopausal women. These tumors are thought to be precursors to low-grade serous ovarian carcinomas, a hormonally sensitive malignancy. The safety of HRT after surgical treatment of borderlines is unknown. Our objective was to describe the HRT prescribing and preventative services practice patterns in women with surgically induced menopause after the treatment of borderlines. We also sought to identify factors associated with HRT prescription. This was a retrospective cohort study of women at a single academic institution between January 2003 and December 2019. We included women with a diagnosis of borderline ovarian cancer who were 50 years of age or younger and had surgically induced menopause, defined as the removal of both ovaries. We utilized descriptive statistics to report prevalence of discussion and prescription of HRT, completed DEXA scans, and prescription of calcium or vitamin D supplementation, all in the 12 months following menopause. Key clinical and pathologic factors were compared in women who did and did not receive HRT using Fisher's exact test. Moving to our results, a total of 55 women were identified, of whom the median age was 43 years old. The majority were white, married, and multiparous. 60% had stage 1 disease, and 76% had serous histology. 9% had ovarian microinvasion, and 19% had non-invasive implants. As you can see in this bar graph, 47% had a documented discussion of HRT after menopause. Ultimately, 25% were prescribed HRT. Only 15% were prescribed calcium or vitamin D supplementation, while 4% had a DEXA scan. As you can see in Table 3, in a comparison of women who did and did not receive HRT, there are notable trends. None of the women with microinvasion were prescribed HRT compared to 29% of women without microinvasion. There was no difference in women with or without peritoneal implants, 20 and 26% respectively. And in the 10 years following the 2002 Women's Health Initiative study, 17% of women were prescribed HRT, compared to 36% in the period greater than 10 years from publication. None of the women recurred of borderline after menopause in this cohort, with a median follow-up time of 27.5 months. In conclusion, only half of affected women had a documented discussion of HRT, and only a quarter received HRT. Preventative services were not commonly performed. Prescription of HRT was not associated with patient or tumor characteristics, though limited by a small sample size. There were no recurrences in women who did and did not receive HRT. Future studies are needed to further assess the safety of HRT in this population and to guide adjuvant decision-making.